During this video, we'll explain what's involved in posterior cervical decompression or laminectomies, which is unpinching the spinal cord. Here, you can see the front of the spine in the neck with the muscles, tissues, and other organs removed. In the normal spine, the bones or vertebra move because there's a jelly-like disc in between them. Over time, this can wear down. The disc slowly shrinks as it wears down and becomes dehydrated. It can lead to spinal nerves being trapped. As this worsens, bone spurs form which pinch the spinal nerves and spinal cord. Here, we look inside the spine. As the bone spurs grow, they pinch and damage the spinal cord. Damage to the spinal cord can cause neck pain, numbness or weakness in the arms and hands, weakness and stiffness in the legs, balance issues and problems with tripping over. All of these may be temporary or even permanent. You're watching this video because a surgeon has recommended you have a posterior cervical decompression or laminectomies. This means unpinching the spinal cord in the neck. After being put to sleep, you'll be placed face down on a special soft mattress. An incision or cut is made in the skin of your neck. Its length will depend on your personal requirements. The muscles and tissues are parted to reveal the bones of the spine. X-rays are used to guide the surgeon to the correct level in the spine. A window is cut into the bone. Various tools can be used. This may be done at one or more levels in the spine, depending on your personal requirements. The surgeon then ensures the spinal cord is decompressed or unpinched. To finish, the skin will be closed with stitches or skin staples. The unpinched spinal cord then has a chance to recover. However, this can take months or years, and for some people it only gets partly better, or it doesn't improve at all. The purpose of this procedure is to reduce pain and improve your hands, arms, and legs. We cannot guarantee that this will happen, but for most people that have this operation, there is some improvement. Out of every 100 patients, between 1 and 5 suffer from a minor or treatable complication from spinal surgery. These risks or complications may include wound infection. This is when bugs get into the wound and affect the healing. You may need antibiotics to treat it. Rarely, an operation is required if the antibiotics don't work. CSF or spinal fluid leak, which requires you to stay in hospital slightly longer to ensure it heals up. Sometimes a further operation is required to fix this if it doesn't heal on its own. Some suffer an injury to a spinal nerve. This is often temporary, but it may, unfortunately, be permanent. If this happens, some patients suffer from increased hand, arm, or neck pain. Some may have altered feelings on their skin or even a numb patch. Some people may form a scar around a spinal nerve. Over time, this can cause pain or discomfort, which may be similar or rarely worse than the pain before surgery. Even with surgery that goes according to plan, your symptoms may continue. In some cases, they improve and then return again. The purpose of the surgery is to improve pain and function, but in some people it doesn't work or doesn't last. Most spinal operations require you to be face down to reach the spine. Parts of your body may feel pressure that they're not used to. This can cause soreness or even abnormal feelings in your body afterwards. This is usually temporary. Serious or life-changing complications occur in less than 1 or 2 in 1,000 patients. These may include one of the following: damage to the spinal cord or nerves, which can temporarily or even permanently affect your ability to walk or use your hands and arms. If this happens, you may require a period of rehabilitation. It may permanently affect your ability to work and live your life fully. There is also a very rare risk of complete paralysis, which means nothing working from the neck down. This may even affect your ability to breathe on your own. If a major blood vessel is injured, This can cause a stroke or brain damage. It may require immediate surgery to try and fix this. Some people cannot tolerate an anesthetic safely. They may have a bad reaction to the drugs or develop complications from surgery. This may include blood clots in the legs and lungs or stress on your heart, lungs, and kidneys. If you've had a bad reaction to an anesthetic in the past, please make sure you inform your medical team. If one of these uncommon risks turns into a complication, extra procedures may be required, such as a blood transfusion or further surgery. If any of these serious complications occur and they cannot be treated, there is an extremely small risk of not surviving the procedure at all. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. You may have a sore throat or neck. Most patients go home within a day or two. You'll be encouraged to do some walking and gentle exercise, which should build up over the next few weeks and months. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you have understood everything.